Hi everyone, I am Dr. Rahul Gupta, Senior Interventional Cardiologist at Apollo Hospitals, Navi Mumbai in Mumbai. Today we are going to discuss about electrophysiological studies and radiofrequency ablation. Now in our heart we have the electrical system of the heart. There is a pulse generator and then there are multiple wires which carry the current to different parts of the heart. And there can be abnormalities of the conduction system of the heart or the electrical system of the heart which can result into arrhythmias. Arrhythmias means abnormal rhythm of the heart. Sometimes there can be fast rhythm or sometimes it can be a slow rhythm. And to diagnose the exact problem, there is a test called as EP study where the full form is electrophysiological study, and the further treatment, if we find an abnormality and we find an extra focus or abnormal electrical activities, we can burn those areas or abnormal part, we can isolate them through radio frequency ablation. There is a catheter which emits the radio frequency which can actually treat this issue. So this in whole is called as EPRFA, electrophysiological studies and radio frequency ablation, usually done together. So it is a very safe procedure. Patient is empty stomach for about 4 to 6 hours before the procedure, and then they are made to lie down on a table on which the procedure is conducted under the cath, which is called as a cath lab, and there is the X-ray camera which moves around the body to take the different photos, and we give a local anesthesia in the groin area, the upper part of the thigh, from where usually the angioplasties are done. The same way it is done under local anesthesia. We take very small catheters near the heart, inside the heart, and then we study the electrical system of the heart, find out the abnormality, and if there is abnormality found, we can at the same time give the treatment through ablation, which is radiofrequency ablation. There are various systems, 2D system and 3D system, which are depending upon the complexity of the arrhythmia, the rhythm abnormality, we would choose either 2D or 3D. And this procedure is absolutely safe. Patient, if it is just an electrophysiological study, patient can be discharged on the same day, or if it is a radiofrequency ablation, we discharge usually within 24 hours on the next day. Since it is done under local anesthesia through the leg, after we have removed the sheath, we ask the patient to keep their legs still for a few hours, after which they are mobilized, they can move around, and it's quite comfortable. So, in all, EPRFA is a terminology used for electrophysiological radiofrequency ablation, and it is done for patients with rhythm abnormalities or the electrical abnormalities of the heart. It is a very safe procedure, and it's like a daycare procedure, and patient can be discharged within 24 hours. Thank you very much.